Hi, I'm Dr. Nicole Vane at Moonlight Beach Dental, and I wanted to talk a bit about some of the products we use here at the office. Now, as I mentioned before, you can see any ad on TV that's going to say kills 99% of all bugs and germs. And the most common ways we do that in the mouth are with heavy alcohol or chemical products that kill off everything, including the good bugs. We don't want that. One single use of alcohol in the mouthwash, while it gives you that good burn, it's actually over drying your tissues and creating a lot of damage because it's killing off the good bugs. So if we do the salivary testing and after we do a thorough cleaning, we're going to recommend some products for you that can help decrease bleeding and inflammation. Now, the first one I like is, and you used to only be able to get this with prescription, is Closis. Now, this one just is really hydrating for your tissues and very freshening for the breath. And I really encourage you, if you feel like you have bad breath, to use this one, but also to use a tongue scraper, which you can get here at the office. And you would scrape your tongue after you brush your teeth and get rid of that extra film of bacteria. But the Closis has active ingredients in it that really do, it's very gentle, but very refreshing. I can't describe how much cleaner your mouth feels after you rinse with this after brushing. And this is spoken from someone who has never used mouthwashes in my whole life, just because I didn't really feel a need for it, and I don't really believe in the alcohol and other additives that are in those products. So Closis is great, you can pick this one up. And we also use Under the Tooth and Gum Tonic, which is the essential oils and active ingredients that are in Listerine that really are bacteriostatic for the bad bugs, except that one won't cause the alcohol effects because Listerine is more than 45% alcohol. So the Under the Tooth and Gum Tonic just gives you the best benefit from those essential oils and also doesn't end up destroying your tissue. And we have that in a mouthwash form and also in an irrigant that you can put into your water pick. Now, if you have an acidic mouth that has high acid reflux or tests with a really low acidic pH, and you're looking for something that's also fluoride alternative, my two favorites right now are made by a company called Elementa, and they're a nano silver. So the nano silver particles are actually really bactericidal, but the suspension of this is a really gentle flavoring, and this bubblegum one is delicious. I mean, my son uses this every night before bedtime and holds it in his mouth, and it's very powerful for also delivering hydroxyapatite and nanohydroxyapatite and remineralizing agents to the tooth that'll help prevent cavities. So this is great for acid mouth and cavity prevention. If you have gum disease and some of the really bad bugs, as I mentioned in another one, we can use the Perio Protect Gel, which is an antibiotic in the gel that's specific for the bad bugs, depending on which you test for, and a peroxide. And it's held in the sulcus deep down in these custom trays against your gum that will keep these bad bacteria from reflourishing after we've cleaned them off with your dental cleaning. Another one that's really good and soothing, especially for bad gum disease, this one uses grapeseed extract and a couple other natural ingredients, is the Dental Sidon products. We have the mouthwash and the toothpaste. I love Dental Sidon. It leaves your mouth so clean and fresh, and yet it is also really gentle. You'll notice that your mouth feels super clean. There's no sodium lauryl sulfate, so none of the fake foaming additives that some people can react to. But it really gives you a fresh feeling because it gets rid of that hairy tooth feel, which is that plaque that stays on your teeth, that sticky plaque. This one's awesome for that and for soothing bleeding gums. The last one is also great for bleeding gums and inflammation and dry mouth, is Stella Life. So after any surgical procedure, this one has a lot of homeopathics that help accelerate healing, but also decrease pain. So we have a concentrated gel that's used for surgical sites, also great for canker sores, cold sores. And the mouthwash is great if you've had a deeper cleaning where the tissue feels really sore and swollen. This has homeopathics in it that will decrease the swelling in the tissue and the pain. but also there's active ingredients in this that will help bacteria from recolonizing and really, really rehydrate the tissues. Both use a coconut oil in the suspension that is really hydrating and gives a great mouth feel that's non-drying. And if you are someone who suffers from dry mouth, this is a great product for you. So those are some of the products I like to use here at the office, in addition to 2 oral probiotics. Now we have one for kids and one for adults. And those again are some of the good bacteria like lactobacillus and a couple of the others that you'll chew on the tablet, and that will dissolve in your mouth and give you some recolonization with some of the good bacteria, especially after you've already rinsed, cleaned, and brushed. This is gonna help keep rebuilding the good stuff. And last, if you're looking for an over-the-counter product, there's some great ones I love at the drugstore. One of them is Tom's of Vane that's fluoride-free. That has a lot of arginine in it, and arginine is really good for remineralizing the mouth and rebuilding the teeth without fluoride. If you're gonna forego fluoride, which I do, fluoride's a known nanotoxin and neurotoxin, I like to use products that just really, really, really help draw in calcium and also to rebuild the enamel. So some of those are, you've heard of hydroxyapatite. Really, really critical that you get nanohydroxyapatite, because there's a lot of products out there that claim to have hydroxyapatite or nanohydroxyapatite in them, but they're not actually effective in the way that they're being delivered. So there's a lot of products I would not endorse. Even if they are cheaper, they're not going to give you that same benefit. And the last thing to look at is, why are you getting this bacterial overload? It could be genetics, but it could also be that you're a mouth breather, that you have dry mouth, or that you have severely acidic saliva, which can come from a lot of different autoimmune factors or come from your gut. For instance, we see Crohn's disease manifest in the mouth. There's a lot of things that we can look at and treat specifically with our cleaning regimen and some of these products. Now, when you're in the office, in addition to using ozone throughout every cleaning procedure with our ultrasonic instruments and also with our rinsing, I also like to use the oral biofilm removal. It's a new appliance I just got. These are not only really expensive, they're really effective. This shoots gently a lot of specialized powders like sodium bicarbonate mixed in with ozone water really gently into the sulcus to remove any sticky biofilm or any of the sticky plaque that can be left behind when we're doing a regular cleaning. So I really love the oral biofilm removal, and it also diminishes that painful scraping feeling that people really tend to want to avoid the dentist for, because they don't enjoy getting their teeth cleaned. And so these are some of the things we do differently here at Moonlight Beach Dental. I'm happy to discuss HR5 test results or our products and make specific recommendations for you, and whatever it is I can do to get you healthy. Feel free to come on in at Moonlight Beach Dental.